So I realized at a very young age that a sound body and a sound mind are very important, more than anything else in the world. And I also realized at a pretty early stage that I had a natural tendency to want to heal people, to take care of them, to listen to them. And I also had a predilection for science and just, being curious about the world and how things worked. And so all of that just kind of added on to me choosing a profession in the medical sciences. The body is an amazing thing. Every day we learn something new about it, especially in the field of obstetrics. There's still a lot that we don't understand, but the science, the research that continues on gives us new answers, a lot of new discoveries, and it's exciting to be part of that. A woman goes through so many changes in her lifetime, all the way from puberty up until the menopausal years. And I've always felt that the more you know, the more you understand about your body, the better you are going to be at taking care of yourself. And so with that knowledge, I always thought that it's important to educate patients in a simple language. We don't have to use fancy diction or terminology, but you communicate one-on-one. It is very important for a woman to be able to have that level of comfort to come out to a doctor and voice all of her questions and concerns. I remember there was a patient, 17 years old, came in for abdominal pain, and long story made short, it turned out that she had cancer at a very young age. And for a teenage girl just going through puberty and high school and all the exciting changes with life, she was suddenly hit with this major change. So, once I gave her the diagnosis of what we were dealing with, typically a GYN oncologist handles the surgery part, but I was able to be there to assist with the surgery, and then through the post-operative recovery time, I stayed with her, I helped her through that, and even for post-op checkups, I saw her and continued to take care of her, even though it was still outside my scope of practice as a generalist. But we maintained a very close contact and relationship through that, and I got to know her as a person and just be able to be there by her side as a doctor and also as a friend. In 3 words, I think most people would describe me as being compassionate, thoughtful, and hardworking. In my spare time, I'm a very hands-on person, whether that be making sugar cookies, making each little individual decorations, or doing crafts around the house, decorating my home. Yes, you can say that I'm very hands-oriented, and that also translates into my love for being a doctor. As an OB/GYN, I also have the opportunity to operate and work with my hands, and I love surgery and learning about all the new different techniques and minimally invasive procedures that's out there. I like being at the forefront of the surgical technology as well. This is really different from most other groups in this area because we really take the time to stay at the forefront of medical technology, treatment, and diagnosis for our patients so that we provide the most up-to-date information for them.